For example, some kids have lumps on the neck. Usually, these are very benign, like from infections, like a tonsil infection can lead to a swollen lymph node, and this can become quite big in children, like 2 centimeter. But if it does not resolve over a month, 2 months, if they're increasing numbers, increasing size, then they need to come to have a biopsy because it could be blood cancer, leukemia, lymphoma, some cancers. Yeah, so if it's something with the nose, if there is a chronic obstruction of the nose and a runny nose and repeated infections, sometimes it's not just allergies or cold or flu. It could be really polyps in the nose. Yeah, and very rarely there are tumors in children, but it's possible. For something in the other big thing I haven't spoken about that's of course very emergency is actually difficulty breathing, and this tend to happen to the younger babies. So the very small airway when you're born, the trachea of a baby is only about 4 millimeters. So if there is any infection at all, it could reduce this airway by 50%, almost within an hour. And the baby maybe comes with very harsh breathing, and those kind of very harsh breathing, and the baby can actually collapse within an hour. So these are important to note. It could be infection, but it could also be a congenital problem where some masses are pressing in the chest that you can't see. Yeah, and so this really needs a multidisciplinary expert team to manage. The other red flag, I would say, for the ear, maybe the infections. If you have a lot of ear discharge for a long time, especially for children below 2 years of age, you have to be very careful because the middle ear is just next to the brain. It's separated by a very thin layer of bone, which is even thinner in a very young child. So there could be brain abscesses, and you need to treat that early. Nowadays, some parents are very worried about antibiotic use, but in some cases like these, antibiotics are really necessary.